Hafa Day, my friends. I'm Jason Salas, of course, and because it is time for Hafa Health, that means we join our friends at FHP Health Center, giving you news and information that you need to know. And we have a new physician who is joining us. My first time interviewing Dr. Aftab Chaudhry, a very, very experienced and learned member of the FHP team. So, Doctor, very good to meet you, and thank you for joining me.
Nice to meet you too.
All right. So, Doctor, your specialty, among several, is you're an expert in the field of oncology. And specifically having these discussions with patients. And you said over the course of your 45-year career, you basically have see patients that are suffering from cancer, making these diagnoses every day. Maybe to start out with, as a physician, what is it like for you to have those conversations, with patients, which I'm sure for a lot of them, that's going to be like, one of the scariest days of their lives?
Well, patients generally are diagnosed by other physicians.
Mm-hmm.
So before we get the patient, they already have a diagnosis established by their family doctor or the internal medicine or the surgeon. So they go in for a certain complaint, and ultimately all the tests are run. That's before we see the patient. So generally a diagnosis is already established. So by the time we see the patient is ready for evaluation, for treatments, basically.
Okay. And what types of what questions do you typically have for the patient during that first consult with an oncologist when you first meet the patient?
The first time we see the patient, there's really a lot of questions. So generally patients come with families, either be parents, children, or brothers, sisters, and there's basically want to know, first of all, what do I have and what type of cancer do I have? And then they want to find out, is the cancer spread or is it still localized? Is there anything that can be done about it? Some of the patients ask you, why me? Why did I get it? There are actually answers to all these questions because, and these are the good questions to ask actually, that how did I acquire that cancer? Why did I end up having it? Because there are some cancers that we can pretty much tell what caused it or how they happen. And that also leads to prevention in the family members or somebody like that, to let them know that, this type of thing can happen and they can help themselves. Next thing they want to know is, what else do I need to do? What other tests I need to run to find out the other places the cancer could be, whether it's spread other places or not. And once we explain to that, then the next question that they ask is, okay, what kind of treatments I'm going to get? So we explain to them what kind of therapy is needed. Subsequently, the question will be, what are the side effects of the treatments? And we go through the side effects of the treatments.
Especially if they have to go through chemo and.
Yes, because there are different treatments we do. Some of the treatment, sometimes the treatment is combined, like we do surgery, radiation, chemotherapy, all like in like a sequential manner or together. So it's basically, sometimes you get radiation first, then you get chemotherapy. Sometimes you get surgery first, then you get chemotherapy.
Right.
And there could be any sort of sequence in that. And so we have to explain to them what's going to happen and what side effects they have to expect. I think the most important question the patients want to know is how long they're going to live. Is the cancer curable or treatable? Something we have to be careful about while talking to patients like this, because there's a lot of misconception of what we tell the patients and what we mean by that. Like we may say, like, you're going to get chemotherapy, you're going to get radiation, you're going to get all these treatments, and you're going to be, there's something called response, okay? And so we tell them, okay, the cancer is going to respond to so-and-so. Then we talk about remission, and then we talk about cure. So these are all different things, and usually there's a misconception amongst the patients, because we may tell the response rate is going to be 100% or 70% or 80%. So they automatically assume that there's a 70, 80, 90% chance that they're going to be cured. So we have to explain to them that response doesn't mean cure. It just
Right.
means that cancer is going to shrink, but cancer generally can come back. So when we say response, it could be like partial response, it could be complete response, it could be a long-lasting response.
How
So
delicate of a matter is it, doctor, to make sure that the patients maintain hope? Because, like you said, I mean, when you deal with the numbers and the probabilities and previous evidence of cases and everything like that, you're dealing with a history, but hope can be a very delicate thing.
it's a very delicate thing, and I think that's why I said the concept has to be really clear
Mhm.
at the time, because we just explain everything the way it is. I don't hide anything from patients and let them know that, well, this is not curable. Unfortunately, the end is not going to be good. Or that, okay, we are going to put that in complete remission and very likely it may be cured. So when we use these words, very likely, they automatically think that, oh, it's going to happen. I'm going to be cured. It has happened before, like many years ago. It happened in breast cancer, where there was a surgeon, his name was Halsted. As a matter of fact, there was a mastectomy connected to his name
Mm.
called Halsted's mastectomy.
I've heard of this, yes.
So what the Halsted used to do this many years ago, more than 50 years ago, what Halsted used to do was he would go on and see these patients with breast cancer, and then he'll do very extensive surgery where he remove a whole bunch of breast, all that muscle around there, and a lot of times go scrape all the way to the chest bone, basically telling the patient that he's cured the cancer.
Mhm.
Unfortunately, there were a good number of patients that came back with the disease despite him taking out all the cancer. So a lot of this happened over the years that patients thought the surgery is the cure. Like once you take it out, you're cured. But unfortunately, the cancer already spreads a lot of times before the surgery is done. So nowadays, the treatments are changed a lot. So what we do now is we treat them with chemotherapy or radiation first,
Mhm.
then do a lot of times surgery, and then with more chemotherapy after that, and then immunotherapy, and then we hope that we can get the remission to last a long time.
And
Still not using the word cure,
sure.
because that's very misleading a lot of times to a
Well,
lot
I
of.
also appreciate, doctor, like, and I think you said very honestly that a lot of patients, when they come to see you after having received a cancer diagnosis, they can be very, very upset. They can be angry. They can be mad at themselves, perhaps mad at God, mad at their family, or mad at whatever situation. But I've also heard of people that we've interviewed over the years was they said they had a cancer diagnosis, the first thing they asked their physician is that they weren't thinking of themselves, they were thinking of their family, and they're like, doctor, is there any chance my wife could contract this, could my kids get cancer? And they weren't thinking of their own diagnosis in the moment, but they were trying to think of their loved ones. Do you
Oh,
see that as well?
oh yeah, quite a bit.
Mhm.
And yeah, we have to explain all that. And that's where it comes in, as I talked originally, that when patients come in, we have to tell them how the patient acquired the cancer, because there is a lot of hereditary cancers. They're genetically related and have to be explained to the patient that, yeah, the family member needs to be taken care of. But again, the concentration has to be on the patient himself or herself, and to explain to them exactly what they're going to go through. I think the main thing is that what we do is to make sure they understand completely what's going to happen. At any point that these treatments are given and they don't know what's going to happen and how they're going to end up, it causes more trouble than good.
Mhm.
The patient, there's a misconception that the family and the patient, and so the clarity is done way ahead of time, and most of us try to clarify way ahead of time the consequences and the ultimate outcome.
Sure. So now that we've established the context of someone receives a cancer diagnosis, they're going to you to find out their treatment plan. Can you maybe give some advice about what patients should do to prepare for that initial appointment with you, or with your colleagues, about starting to have those conversations and starting to think about, about treatment and the way that their life will dramatically change?
I think, a lot of patients nowadays, they have already Googled everything. So a lot of times they know a lot more than we even can think of. So we have quite a
Is that a
few,
good thing?
sometimes it is, sometimes it's not.
Uh,
And I think
WebMD will drive you crazy.
exactly, informed patient is the best patient. If they already know, most of the things, then it helps us a lot that they understand their problem. But again, sometimes too much Googling is too much trouble, because in Google's, they really give you only basic things and not go into detail. Because most of the Google, of course, they're not doctors, they're people in general who give suggestions and this and that. And then they start reading about treatments that we don't do, like herbs and other things. And that has been an issue for us, because they come up with already a built-in idea like, oh, such and such herb was tried like on 200 patients, and they found it to be as a cure for that particular cancer, which majority of the times is hocus pocus. And all the drugs that are in the market, especially all the herbs, uh, NCI does trials on them. Once they know that there are possibility that they may have a cure or treatment available, they do studies first. So that's how we find out that, that certain drug or some herb is going to be effective or not.
Okay.
So yes, an informed patient may be too informed sometimes and could be detrimental, actually.
Okay. So maybe
But
maybe should they just maybe just take a very simple, um maybe a notepad and just have like several questions? And do you recommend people go there themselves or with loved ones and with family members, because it is the strength in numbers? And
we generally recommend all the family members to be there if possible,
okay.
because otherwise we end up making phone calls to mom, pop, brothers, sisters on the side, because they have questions and they want to know. So we want to make sure everybody's there at the same time, so we don't have to explain to everybody. Yes, it really does help. And family support is very important in patient care, because a lot of these patients get very ill, and they have to be brought in to the hospital or to our clinic, and it has to be on time. Chemotherapy is all about time. It is very time, same way with the radiation therapy. It's very timed. You have to be there a certain time. You have to get out a certain time. Sometimes the patients don't have any car or any other vehicle available to bring them, so they have to be brought in by the family. So yeah, it's very important.
Okay.
And I think that's probably the most important thing in cancer care is family being there for them.
Well, we on Guam know all about the power of family. So
Yes.
and unfortunately, doctor, I've saved the last question, which is probably the most emotionally heavy, is for patients that get certain types of cancer diagnoses and that they come to see you. How would you recommend they go about, beginning to make very, very big decisions, and probably very, very scary decisions, and going forward with that line of thinking?
Pretty much majority of the cancers, we can pretty much tell the way they are spreading or where they are in a certain patient, if these patients are not going to be able to live very long. So when that happens, we explain to the patient that really need to get their things in order, because otherwise, there could be more problems for the family. So that happens because we have already determined a certain prognosis in these patients, and we can help them out.
Okay. Well, doctor, thank you for your honesty and for the professionalism and the compassion that you bring to a type of practicing medicine that's, I'm sure, very, very emotional for you and your colleagues and everything. But it's good to see that we Guamanians have people like you taking care of us, as well as you and all your colleagues at FHB Health Center.
Thank you very much.
All right. Good talking to you, doctor. Have a wonderful day.
You too.
All right. That's Hafa Health, and everybody. That is Dr. Aftab Chaudhry, taking care of you, one of the many learned professionals over at FHP Health Center. We'll see you next time.
Thank you for watching this video from Take Care and FHB Health Center. For more videos like this one to help you live a more balanced lifestyle, please subscribe and like our social media pages. And don't forget to turn on the notifications. For more information about Take Care and FHB Health Center, please go to takecareasia.com.